Is this gene therapy going to be able to make it possible to where people with these blood diseases won't have to get transfusions?
Yes. They'll be cured. They'll be asymptomatic.
So you'll get the gene cell therapy essentially once, and then it's done?
That's it. Done.
Really?
Done, man. Done.
When do you hope for this to happen?
We're putting an insulator on now, and we're making sure, I'll be getting a call by the end of the week probably, that the insulator is not hurting the efficacy of the drug.
Okay.
So, and show my book again.
That's exciting. Hold it up. Hold it up for us. Tell people listening and watching
where they
can
and I don't give a shit
Hold
about
it up higher by your face.
I don't give a shit about the money. The money's going to research anyway. But you know what? If you don't read it, you're not going to understand that this is true to what I'm saying. And it'll be great for you guys if you want to go to the stock market, because it tells how I got into the stock market. It'll be great for you people if you got a sick father, a sick son, a sick daughter, a sick cousin, because it tells all about that. And it'll be great for you people if you're like out of the box, not cookie cutter kind of people, and you're wondering, geez, how could that guy get on an Oprah Winfrey show? Twice. How is that guy one of America's most eligible bachelors? How did he end up doing what? Look, read about it. It's a great story. It's a feel-good story. And it's none of this bullshit, woe is me, my daddy beat me up, and, oh, my uncle, he molested me. Oh, my God, I could never, ever see another hot dog in my life, because every time I saw a hot dog, I thought of my uncle. Come on with all that bullshit, will you? Come on.
So, we got to go back real quick before we end this thing. You're in Playgirl. You didn't have a spread in Playgirl magazine, did you?
Playgirl magazine. I had all my clothes on.
Okay, good.
You can go and find it.
Thank God.
Okay, and I was in there with.
If you were in there,
Sylvester Stallone.
I wanted to have the signed copy to put on the bookshelf.
I got it, but you know what? I'll send you a copy. But I was in there with Sylvester Stallone and Magic Johnson. By the way.
Okay.
Larry Johnson, Magic's brother, who I've collaborated with on sickle cell disease, by the way. Good people. So, it was kind of helpful that at least when I called, I said, hey, we were in the same magazine together. You know what I'm saying?
That's awesome.
No, it is awesome. And again, I am an idiot, okay? And I'm a high school dropout. And I'm not the sharpest guy in the drawer. But I try to be a good guy and a good American and a good capitalist, by the way. And as a good capitalist and a good American,
with a socialist heart,
with a socialist heart, I believe that the first guy to sacrifice should be the boss.
That's very well. That's the truth. I agree with that.
Yeah, Bezos.
You got to lead by example.
Yeah, forget about how much is he worth, $1 trillion. Come on with all that bullshit. Give bonuses to all those freaking truck drivers. Take 90% of all your money and give it away to your employees.
Yeah.
Let them get their health care. Let them get everything. That's what capitalism in America is about. It's not about dying with 20 zeros after your name. What good's that going to do you?
I agree. Pat, thank you for doing this. I very much appreciate it. Tell people where they can buy the book.
So, Flight of the Rondoni. Oh, by the way, stop. I got to tell one more thing.
Yeah.
Why is it called Flight of the Rondoni? What is that? That's a bird. What is that bird called? Well, in English, you'd probably call it a swift. In Italian, you call it a rondone. Now, the rondoni flies from Africa at about 140 up to 140 miles an hour. It gets into our town, and it lays eggs in our cathedral ceilings or roof. And it flies around and around. But the thing about the rondoni is kind of like me. It's short. Doesn't have a big nose like me, but it's short. But it's got like real long wings. So it can't land on the ground, because if it lands on the ground, it can't take off again, because the wings hit the ground when it tries to take off.
Oh, okay.
So it's always got to land 2 to 3 stories high, okay? And when they go in our piazza from like March to August, September, and they're flying around, every now and then they collide because they go so fast, okay? When they collide, guess what happens? They fall to the ground. Well, when they get to the ground, we know what to do. We take them in our hands as gently as we can. We cup them, and we throw them as high as we can into the air so that they can begin flapping their wings and take off. Well, when I was a kid, Big Mama, that wonderful dark-skinned woman from Northwestern Hospital, Clarence, Bryant, that wonderful judge who told me to go to the military instead of jail, that wonderful dark-skinned man. Joey Gornick, that Croatian boss that I had when I loaded the trucks. My mother, my attorney, that Jew, Ken Sussman, who I love with all my heart. I kind of collided a lot. I wasn't too bright. I was at Rondoni. And they picked me up and threw me in the air so I could fly again.
It's beautiful.
And I'm going to die soon. You know, we all are.
You're not going to die soon.
Well,
you look like a young, healthy man.
Yeah, but what's soon? I mean, I don't know, 50 years? It's pretty soon. I mean, we've been on the planet 5 million years. So all I want to do is I'll raise some more money for my company. We're going to go after other therapies. We're working on a therapy, CD47 now, which is a great invention. I want to try to do a little good. And we're not going to make the company a big company so we could, give everybody $100 million or whatever. No. We're going to try to do good research. And in the United States, we can do good research, and it doesn't have to cost $1 trillion because we're not going to let the executives steal all the money. We're putting an insulator on our product because Michelle Settling at Sloan Kettering discovered that these lentiviral vectors, these gene therapy, need an insulator because there's been cases of leukemia and stuff for patients treated without an insulator.
What's an insulator?
An insulator is, so when the gene goes into your chromosome lines, it could fall next to a oncogene, like a cancer gene, and trigger it.
Oh, shit.
So we want to put an insulator in between our gene that we're inserting, our vector that we're inserting, and the other gene, so it won't trigger them.
Yeah,
so we're doing that now. We're doing that now.
Okay.
But Bluebird Bio might be approved by then. Who don't know. They're going to be, in June 8th and June 9th, there's going to be a public hearing that the FDA is calling for Bluebird Bio. We already sent in it's called a citizen's petition. And we said to the FDA, we don't think they should be approved because 1, they have a mutant gene. 2, they've had problems with patients. 3, they don't have an insulator. 4, they butted in line and acted with treachery to get where they are. And the 5th thing is something called orphan drug exclusivity, because if they get orphan drug exclusivity, they won't have competition for 7 years in the United States. So we said, FDA, we don't think you should allow them to be approved. But they might get approved, and that's not the fault of the FDA, because it's not the FDA's thing to be looking at court cases, by the way. Right. So, and they might get approved, and that's it. But that's how the court case ended, basically. And we find out that Bluebird Bio is infringing on our product. So now we're suing them for infringement. So maybe economically it might be the best thing in the world that they get approved. Because then why? They're going to have to pay me because they're infringing on my product. But we think that we need an insulator on our product, and they need one as well, we believe. And I was just at the American Society of Gene and Cell Therapy in Washington, D.C. for a week, talking to, all of the people at FDA, all of the researchers, all of the whatever. I gave out about 30 of my books, it was kind of neat and wonderful. But there's a lot of great people at the NIH, which is the National Institute of Health, National Cancer Institute, FDA, SEC, FBI, politicians, you name it. We've got some of the best in the world. Doctors, CEOs even. We've got some great, wonderful CEOs. Emil Kakas, John Ballantyne, Michael Chambers, CEO of Aldebaran. And I'm talking about companies that are worth hundreds of millions, if not billions of dollars. And they're great guys, by the way.